everybody. Thank you, Councillor Karagianis, for the warm welcome, and thank you all for being here this evening. As you've heard, I'm Dr. Eileen Davila. I'm Toronto's Medical Officer of Health. And I'm very, very pleased to be able to be here with you this evening and to speak with you for a little bit of your time this evening. I do want to thank you for taking the time to be here, and let me tell you what I'm hoping to do in the next few minutes. First, what I'm hoping to do is to provide you with an update and current facts on the novel coronavirus. I also want to provide you with a bit of an opportunity, a forum to ask any questions you might have, and finally to make sure that you are given evidence-based facts so that you can address any concerns that you may have, or that your family may have, or that your friends may have in respect of this novel coronavirus. So it's interesting, as of yesterday, we now have a new name for this novel coronavirus, and it is now being called COVID-19. That's COVID-19. So let's start off with the most important thing that I think you need to know at this time. At this time, the health risk to our community presented by this novel virus remains low. So I'm going to say that again because I think it's very important. The health risk to our community at this time from this novel coronavirus remains low. At present, there are only 2 confirmed cases of the novel coronavirus in Toronto. My staff continue to follow up directly to connect with these 2 people through daily phone calls while they remain at home in isolation as they recover. We are monitoring their symptoms, and we were going to end their isolation and allow them to return to their regular activities when we have 2 tests taken 24 hours apart that show that they have no more virus in their bodies. I want to take this opportunity to remind everyone that we often use terms in public health like cases or contacts. But I cannot emphasize enough how important it is to remember that we are talking about people who are members of our community, right? We're not talking just about abstract ideas, cases, and contacts. We're actually talking about people who live here in our community. And I think with that in mind, we need to respect their privacy and allow them some time and space to recover. So this novel coronavirus, now called COVID-19, is a new virus that was identified only about a month ago. The health community around the world continues to gather new evidence on this virus. It was only identified about a month ago. And as new scientific data comes out, and as new scientific data gets verified, our staff at Toronto Public Health, provincial health staff, federal health staff, partners all around the world, we adapt our approach, we adjust our approach in order to follow the best available evidence. We expect that the situation will continue to change as we learn more and as more facts, more evidence-based facts are confirmed. I think it's also important to share with members of our public what a coronavirus actually is. So coronaviruses come from they are a large family of viruses, and they cause respiratory illness, ranging from the common cold, your run-of-the-mill, everyday cold that we get from time to time, to more severe diseases such as severe acute respiratory syndrome coronavirus, more commonly known as SARS, and also the Middle East respiratory syndrome coronavirus, otherwise known as MERS-CoV. Late last week, our partners at the federal level, the Public Health Agency of Canada, provided an update on this new coronavirus, COVID-19. And at that time, they indicated that in order to support global containment efforts and to limit the spread of this virus, they were changing their recommendations to the following. They said, if you have traveled to Hubei province in the last 14 days, you should limit your contact with others for a total of 14 days from the date that you left Hubei province. When they talk about limiting contact with others, this means self-isolating and staying at home. They also ask these individuals to contact their local public health department within 24 hours of arriving in Canada. And for people who live in Toronto, this means contacting Toronto Public Health. And the number at which you should reach Toronto Public Health is 416-338-7600. The advice as well from the Public Health Agency of Canada talked about what people should do if they have traveled from mainland China outside of Hubei province in the last 14 days. And the current approach that was put forth by the Public Health Agency of Canada is that people who have traveled from mainland China in the last 14 days should monitor or watch themselves for respiratory symptoms, things like fever, cough, or difficulty breathing. And if you develop these symptoms within that 14 days after returning to Canada, the advice is to seek medical care immediately, but to make sure that you inform your healthcare provider or your local public health department about your symptoms and your travel history before actually going to seek medical care. Again, I can't emphasize enough, and I want to repeat, that the risk to our community at this time remains low. So with that, my advice, our advice from Toronto Public Health to our community remains the same as it does for cold and flu season. And that is to use good infection prevention and control practices. The same practices that we usually recommend in cold and flu season, which usually runs every year from about November until March. These measures may seem very simple. They may seem very basic, but they are truly very powerful and probably the best way to protect yourself and others from getting sick. So what am I talking about? What are these measures? They include things like washing your hands frequently. I'll say it again because it's that important. Wash your hands frequently with soap and water. And if there isn't soap and water or a hand washing facility available, you can use an alcohol-based hand sanitizer. Cover your cough or sneeze, ideally with a tissue. If you don't have a tissue, you should cover your cough or sneeze with your sleeve or your elbow. And after you cough or sneeze, wash your hands. We also recommend getting an annual flu shot. This is available at clinics and pharmacies all over our city. And finally, it is important for people to remember that you should stay home if you're sick. Right? This is one of the best ways to prevent the spread of disease from yourself to others. This is also these methods, the things I've just told you about, are the best ways that you can help prevent viruses from spreading in our community. I think, outside of offering advice, it's helpful, I think, for me to share with you what it is that we do in public health on a day-to-day basis when it comes to infectious disease. So as public health professionals, we are notified of infectious diseases routinely, every single day, in fact, as they are identified by healthcare providers, like doctors in our community, and confirmed through lab tests. When we are notified of instances of infectious disease, it activates the work of a whole system of skilled public health professionals who work behind the scenes. We begin by following up with the person who is sick to understand the circumstances surrounding their illness, and we identify those people that they've had close contact with and settings where they might have been during the time they might have transmitted the disease to other people. We do this as part of our work in public health each and every day. We do this work to make sure that when these situations occur, people are notified that they may have been exposed to a potential health risk, what signs and symptoms they should be looking for, and when and what medical treatment they should be looking for or they should seek out if they become sick. We also do this to help people protect their health by accessing timely treatment and to help prevent the spread of infectious diseases here in our community. I've already said this once, but I'm going to say it again. I think it's important to remember that this new virus, this new coronavirus, was only identified about a month ago, right? 1 month ago. So we are still learning quite a bit about this virus. And as we learn more about this virus and how it's transmitted, public health officials all over the world are updating their approaches in response. I think it's also important to note that viruses respect no boundaries, not geography, not income, not race, not religion, and not political perspective. It is understandable. This is a new virus we're talking about. So I think it's understandable that with a new virus, there are lots of questions, things that remain uncertain, things that we're still trying to understand. And when there are uncertainties, things that we don't know about, things that we're still learning, people get concerned and they may worry. So given that this is an evolving situation and that we are still learning, we continue at Toronto Public Health to remind people of the importance of using credible sources of information to stay informed. I can tell you that at Toronto Public Health, we are updating our website frequently as new information is confirmed. And you can turn to our website at Toronto Public Health to keep yourself informed. I would also encourage you to contact our hotline for any questions or concerns you may have. You can reach the Toronto Public Health Hotline at 416-338-7600, Monday to Friday from 8:30 in the morning to 8 at night, and on weekends from 10 o'clock in the morning until 6 in the evening. And on that hotline, translation is available in many languages. So in conclusion, I want to thank you for taking the time out of your busy schedules and your busy lives to get informed about this situation and this new virus. I'd be very happy to take any questions that any of you may have.
Can I ask the first question? You say that 2 patients stay at home. Do they receive any treatment or just stay at home?
So right now, they are doing well without any specific treatment.
And another question. I think one person discharged just today, and one patient discharged today. Is that right?
So
According to news, one patient has already discharged today, so they are no longer infected.
So yes, there was an individual, right, here in Ontario,
Yeah.
who was a confirmed case of coronavirus.
Yeah.
And as I mentioned to you, our cases, we're continuing to follow up, and we will clear them or release them from isolation. They are then able to return to regular activities once they have had 2 tests taken 24 hours apart that shows that there's no more virus in their body. So you're right, there was one person of the cases that we've had here in Ontario that has already made it with those 2 negative tests. So the virus is gone from, they had the virus is now gone from their body. So that will happen with all the other cases. Same thing, you need to have 2 negative tests, 2 tests that show no more virus in the body, and those 2 tests have to be taken at least 24 hours apart.
So this person gets well by himself without any treatment.
So when it comes to this novel coronavirus, if we're going to talk about treatment, there is no specific treatment at this point. And from what we understand of the many cases that have happened all over the world, and as I said, we're still learning because it's a brand new virus. But when we look at the cases that have occurred throughout the world, I'm not just talking about Canadian cases, you have seen some people who've had very mild illness and they get well by themselves, and some have required hospitalization and have needed some kind of treatment, and others, unfortunately, as we know, have died from the disease. So, but there is not a specific treatment as yet for this new coronavirus. They are trying many different viral medicines or antiviral medicines and testing out which ones might work. But there isn't a specific one quite yet, because again, this is a new virus, only identified about a month ago. Yeah. Hi.